Hi everyone, my name is Nina Anchugina. I'm a Deputy Director and Senior Data Scientist at the Center for Social Data Analytics, and today I'm going to talk about COVID-19 tracing, contact tracing apps, what works. So let me talk a little bit about the center first. So the Center for Social Data Analytics is based in Auckland University of Technology and the University of Queensland. In our work, we use data and technology to solve high-stakes social problems such as child maltreatment and homelessness. And our tools are being used by government agencies in a number of US jurisdictions. On this slide, you can see the core principles, the core features of the work we do. So that includes a range of methods. For example, we use predictive risk modeling. Collaboration, that includes working with leading researchers and subject matter experts for the domain we are working in. So, for example, child maltreatment, safeguards, ethics, social license, community engagement. All those are really core components of our work and is an integrated part of any of our projects. We also make sure that we have evaluation of our tools to make sure there are no unintended adverse outcomes and the tools work as intended. And the last word on this slide really sums up what the center is about. It's all about impact. So impact is something that really makes the team excited and to use research and to keep finding and implementing those innovative solutions to impact people's and communities' lives to the better. And our work is known internationally, in particular the work in predictive risk modeling and child welfare was profiled in New York Times, and recently there was a documentary on Netflix as well, so if you are interested, please do take a look. And you might be wondering, how did CSDA get involved in this type of work? As you might see, our profile is a bit different. So, because of this international reputation of the center, the director of the center, Professor Rima Vaidyanathan, was invited to be on a technical advisory panel for the UK COVID-19 digital tracing app. So, at that time, UK was further ahead in terms of pandemics compared to New Zealand and Australia, and so through that engagement with UK, we started being involved in New Zealand and Australia, and it quickly became apparent that there was an opportunity to help, and there was a clear gap with not enough people with expertise in human-centered technology solutions. What we did was we put a multidisciplinary team together. Normally those are people that we usually work with in other domains. So we had ethical specialists and community engagement specialists as well. Because of the nature of the project, we had a public health specialist involved as a domain expert. So the expertise that I brought to the team was in mathematical modeling, as I happen to have PhD in mathematics. So really the goal of the team was to provide credible advice for agencies and governments around the development of COVID-19 digital contact tracing solutions. And what we quickly started to observe that there were very similar challenges for governments in New Zealand, Australia and UK that they were facing at that time. So what was happening was that there were a lot of very complicated and comprehensive models of COVID-19 pandemic, but government really struggled to interpret those despite this comprehensiveness, and translating those models into policy turned out to be a really tough challenge for governments. Also, governments were under immense amount of pressure to find solutions given those huge concerns in this, like public health concerns and economic concerns. What we also have seen is that private sector was willing to offer technical solutions to enhance manual contact tracing, But at that time, it was really hard to distinguish which of those would work. And government has had difficulty responding to those offers from private sector. There was a lack of appropriate analysis, not enough critical voices, and on top of that, really immense time pressure. So governments were in a very hard position, and this is where our work really filled in the gap and provided some guidance for governments and agencies in this really what can be described as very unenviable position. So I'm going to talk to you about our key recommendations from the policy primer. And those recommendations reflect the multidisciplinary nature of the theme as well. So what we set out to do in this work was to put ourselves in the shoes of the government official who was required to explore different digital options in terms of contact tracing and develop advice from all the key directions that we usually look at socio-technical solutions from. Okay, so first of all, let me introduce a few basic epidemiology concepts some of you are already familiar with. For example, R naught, right? R naught is basic reproduction number. What it tells you is the average number of people to whom an infected person will transmit the infection. And you can think about it in such a way that the magic number here is really 1. So what does it mean? If R naught is greater than 1, then there's exponential infection growth. If it's below 1, then the infection dies out. And initially there was a quite variety of different estimates for R naught, and so we looked into different scenarios. So another concept for that I need to introduce here is effective R. This is a reproduction number after some interventions have been introduced, for example, physical distancing or school closures. Next, think about a person. So day 0, they became symptomatic, right? Now think about all those people that symptomatic person was in contact with prior to they became symptomatic. So we call those people first order contacts. So, and as soon as we assume that as soon as symptoms came out, the person got immediately isolated and tested and didn't create any more first order contacts, right? So I'm now going to show you share with you the first recommendations, the need for speed. So what this picture shows you is how many additional infections those first order contacts have created as a result of not being isolated straight away. So let's take a look. Those charts are generated for different estimates of different R naught values. So let's take a look at R naught 3.4, this red line, for example. So what it shows you is that on the day when the person gets isolated, not them, but their first order contact already on average have infected one additional person. If it takes you 2 days to find and isolate those contacts, on average these first order contacts have created 2.5 extra infections. And if it takes you 4 days, then on average more than 4 people have already been infected. So you can see that this curve actually increases very steeply. What you can also see is that around day 8 the curve becomes flat, and what it means that if you delay your contact tracing past that time, it's really hard to control this first order transmission. So it's worth mentioning here that this graph is just about the results from one case. So now if you think about all different cases, each of those cases that are tested positive for COVID-19 will create curves like that. This is where we see exponential growth. But the key message here is that the speed with which cases are identified and isolated is very important. If too much time goes by, the damage is done, and the impact of contact tracing on transmission really reduces. And because of this, the need for speed comes in place. And in order to get that fast, you need some sort of technology. And this is where we start talking about COVID-19 digital contact tracing applications. So think about the situation when a person becomes symptomatic and they got tested. Now, instead of going manually through their contacts, trying to reach out people on the phone, as soon as they get positive results, they get instantaneously notified through the app. So this is what I mean when I talk about digital contact tracing, this ability to have this instantaneous contact notification. If you compare that to manual tracing, you can understand how this can help in terms of increasing the speed. Alright, the next one, high uptake is essential. So the natural question that comes up for a policymaker is, well, how many people need to use this app in order for it to be efficient? What your uptake rate should be? Well, this target uptake actually depends on a couple of things. So the first one is the maximum acceptable delays that you need to maintain in order to control epidemic and the speed of manual tracing. So that the target delay also depends on a number of things. So for example, if you are not very efficient in terms of finding all the contacts and notifying them, then your target delay should be shorter. But if there are some interventions in place, such as school closures, potentially you have a bit more time. So there was work done by a group of researchers from the University of Oxford, published in a very prestigious science journal, Science, that shows that even if you have perfect contact tracing and isolation, but no additional interventions, then the target delay required to control the pandemic should be shorter than 72 hours from onset of symptoms, right? So what this chart shows you is a combination of manual tracing and digital app uptake, which helps you to achieve the target delay. So if you look at this blue curve, all points on this blue curve allow you to achieve this equivalent to this target delay of 3 days. For example, if you know that manual contact tracing time takes on average 4 days, if you complement it with app uptake of 60%, it still brings your target tracing time to 3 days. If it's 5 days, then you need 70% of uptake, right? So the natural question here for a policymaker is what's easier really, whether it's easier to reduce your manual contact tracing time to 3 days, or whether it's easier to obtain this high level of 60% uptake. Moving on, the importance of social license. So what the pandemic really has uncovered is that the uptake of those digital apps is really important. But in order to achieve this high uptake, what you need is trust of the community, and it becomes really critical, otherwise people simply won't use the app. So let me introduce you the concept of social license, which is really at heart of what we do in predictive risk modeling in child welfare. So this is a quote coming out from the work done by Data Futures Partnership in June 2016. So where people trust that their data will be used as they have agreed and accept that enough value will be created, they are likely to be more comfortable with the use of that data. And this is referred to as social license. So there's a number of different aspects to think about, but social license is really critical for technology adoption. The next recommendation is around addressing community concerns. So community engagement is recognized as being a key vehicle for achieving that social license. And there was some polling data that shows that in terms of digital contact tracing, privacy is something that people are really concerned about. However, citizens really lack the ability to distinguish between those complicated privacy designs. They can't be reassured by them. So the way to address those concerns is really through community engagement. I understand that in the situation of pandemic with a lot of time pressure, it might be really hard, but however short, however robust that engagement is, it really needs to be prioritized by governments, because that allows to surface the concerns that people might have and questions that they want to have answered and address those concerns. All right? Next one, number 5, communicate benefits. What all of us have heard a lot about is the benefit of those digital contact tracing apps for public health. What is not very often communicated is that there are also significant, but perhaps a bit less obvious, personal benefits from downloading the app. So in particular, if you think about it, the majority of infections are actually transmitted to household members and co-workers. So really, by having the app, you are keeping your family and your co-workers safe, and you help to reduce the transmission. And additionally, if you think about your social circle, say if we have like a local communities that all have the app, it doesn't really matter what happens on the national level in that regard, but that community, that local community, can keep themselves safe and help to reduce transmission. So in a way, it's like a local public good property. So even if you act in very kind of personal, from perspective of personal benefits, you can still help with national take-up. And I think there is definitely an opportunity to communicate those benefits a bit more. And finally, the last recommendations is probably, again, one of the most important ones, actually, showing impact. Why is that? So the contact tracing digital apps are somewhat unusual goods. We can describe those as credence goods. What are those? So even after you consume those type of goods, you don't know whether it actually works. So an example would be a doctor recommends you treatment A over treatment B, and say treatment B is doing nothing, to do nothing. And even after you consume that treatment, you actually don't know. You can't really tell whether it works or not, whether it was better than another alternative. In such situations, a lot of trust is actually required. And the challenging nature of these contact tracing apps is that once downloaded, they basically sit very passively on your phone, and even if on occasion you might get notified, but most of the time it's just sitting there quietly and you don't know whether it works or not. So some sort of rapid evaluation is required and frequent communication of that the app is really working, so ongoing feedback from impact. Because as time goes by, and if people don't see that impact, then skeptical citizens will stop using that. That's really something that undermines people's trust, and it becomes much harder to maintain it. And ongoing feedback loop from impact and really credible evaluation strategy is something that is really important, because we need to know that the app is actually working well and it does what it's intended to do. And unfortunately, we haven't seen any great examples of that. So, for example, for COVID Tracer in COVID Safe app in Australia, all we can find out is how many times the app has been used by contact tracers, but what we really need to know is how well the app delivers on its promise. Has it slowed the spread of the infection, and how much? So evaluation really needs to be built into the tool from the start, and without evaluation, it's much harder to maintain, to gain the trust and to maintain the trust in the future. So those are key recommendations. I'm next going to talk a little bit about New Zealand and Australia government response to COVID-19. So clearly, as I mentioned before, governments were under a lot of time pressure and in a very difficult position. To be clear, the technology was out there, and by that time, there were multiple solutions existing overseas, including, for example, Singapore app. And there were also a lot of people from private sector willing to offer their solutions. But navigating through those options, like replicating overseas app, building something in-house, or taking the help or taking something developed by the private provider, turned out to be really difficult for the government. This is what we have seen. And the questions that I suggest you to think about in this context is really whether technology is a solution. So first of all, I hope that by now you can see it very clearly that we are really not talking about a technology solution here, but rather a socio-technical solution. So therefore, for successful implementation of the type of solutions, there's a number of components that got to be resolved, such as appropriate impact evaluation, design, social license. So that brings a lot of challenges. And it's also worth pointing out that when we were developing this policy primer, it was prepared for exponential growth of the pandemic. So when Australia and New Zealand were looking overseas at the time, it seemed very real that we could reach that point of exponential growth where manual contact tracing is no longer viable. So really the technology seemed to be the only hope of scaling those efforts. But luckily in New Zealand, this ability of manual contact tracing and the capacity never got properly tested because we never reached that exponential level, luckily enough. And so if we want to talk a little bit more about the actual app, so New Zealand COVID Tracer, it's more of a support to manual contact tracing. So in the sense that it's more like a digital diary. So I would say there are conversations about notifications, but really it doesn't notify the immediate contact, and it's somewhat unusual design. So in the sense that there is an option of notifying the contacts who were in the same venue, but you might be sitting in a completely different corner. So its ability to, it helps, but it has limited ability to speed up contact tracing. In the same way, Australian digital contact tracing apps, which is called COVID Safe, it's more like a diary too. But what it really does, it actually gives the list of different contacts to manual contact tracers. Again, that helps with manual contact tracing, but it doesn't help to increase the speed greatly, which we have seen is very important. So I think the key message to think about here and the key takeaway is that when we think about those apps, it's really important to actually look under the hood of the technology and understand what it actually provides. So does it help to increase the speed? Well, if it doesn't, it might help with something else, but the value that it could add by definition is limited. I'm now going to wrap up, and you can see all the recommendations that I have highlighted today on the slide. Basically, I have highlighted that there are many aspects to successfully developing and using socio-technical tools. And I think what worth thinking about is that those type of socio-technical solutions, they're not going to go away, and they are going to be required more and more in private sector and in government as well. So what we have seen is that government actually needs quite a lot of guidance and support on this, and has a number of challenges even in procurement of those type of solutions. We have also been approached by private sector providers who have developed their own COVID apps and who needed some help in terms of social license as well. So I think the private sector starts understanding as well, gets more understanding and interest in socio-technical problems. So I'm going to finish here and basically saying that guidance around some of those principles that we talked about today can be used in other settings and contexts where socio-technical solution is needed. And if you are interested to know a little bit more or read the policy primer, please you can find the policy primer in our website, CSDA.ac.nz, and please connect with us if you are interested. So thank you very much for your time.